Good evening, everyone, and welcome to ATP Live Monday. This is another beautiful Monday evening, and it's my pleasure to welcome you all to ATP Live. Feel free to drop your questions in the comment section, and then we'll try and answer them in the next 1 hour. In the interim, I'm just going to make sure I share the video to all our various platforms so that everyone can see and everyone can hear us. So, welcome everyone, whether you're watching me on Instagram, on Facebook, or on YouTube, whichever platform you're watching from. I want to especially welcome you to ATP Live Monday. So, I'm just going to make sure I share to all our groups now, and then we can start. So, welcome everyone. I can see those of you joining us on Instagram. Welcome. Welcome, welcome. Start dropping your questions uh, as soon as you join us. Invite your friends, send them a link to the video, send it to them, direct message, just share it so that everybody can join us to learn this evening. So, welcome everyone. I hope your day has been wonderful. Been a wonderful day for me as well. Um, okay. I'm just going to check that it is pinned in the groups. So welcome, welcome, welcome. If you're coming, please drop some comments. Let me know you're there. Let me know you can hear me, you can see me, and let me know how your day has been. And if you have any questions about the health of your children, feel free to start dropping them. We have just about 60 minutes to do this. So the earlier we drop our questions, the better. And of course, I hope we're all aware that ATP is fully operational now. We are back from the holidays. We miss you guys. But we're back for the past 1 week now. So if you have any questions on the health of your children, you can always post it to our Facebook group from Mondays to Saturdays. And if you have any question about adult health issues, you can also post to our ATP family Facebook group. If you need some emotional, psychological support, maybe you've lost a child or something like that, you can also post to our ATP Still a Mom. For the first time mom, you can post your question on our HepTM moms group. And so, yeah, so we have all these groups available for you to post your questions. And of course, if you want to read about any health issues, you can read on our website. We have lots of articles on most important health issues that have to do with children on our website www.askthepediatricians.com, and some of you do ask your questions under the article as well, which we try to respond to, though it may not be as fast as the Facebook group. So if you want something urgent, you may post on the group, but if it's not urgent, you can also leave it on our website and we'll respond to them. All these past videos and other videos are available on our YouTube channel as well as our Facebook page, Ask the Pediatricians Foundation, as well as even on this Instagram, because we leave the videos there for you to watch later on. And of course, we also have our podcast, Ask Dr Gbemi ATP podcast, where you can listen to topical health issues. And on Thursdays, usually there's always a fresh episode on the podcast. It's available on many podcast platforms, including Spotify, Google Music, Google Podcasts, Amazon Music, most of the podcast platforms. Once you search Ask Dr. Gbemi ATP, you can listen to all the past topic discussions that we've had. and or different new topics that we're discussing. So that will be a good platform, and it's something you can just listen to all day long as you learn more about your children health issues. Last week I discussed about child health strategies. I discussed it in full. I will recommend that we all watch and listen to that. So those are all the platforms where you can learn from on our Facebook groups, our website, our YouTube channel, Instagram, and of course our podcast. And we want to encourage you to help us share as you're learning, keep sharing it. Let's more and more people know about all this important information, and that will help them to make sure that their children live and all that, because that's our goal, that's our mission on Ask the Pediatricians Foundation. We're committed to the health and the welfare of children, and we don't want any child dying from preventable causes of death. And that is why we do all this health education information, and so that's why we go also for our community outreaches. All right, so I think I've given all the announcement, and we also have a lot of materials for first time mom. They are currently in digital formats, but they will soon be available in book format this year, which you can read. It's really for the first time mothers, pregnant mothers, all those information you really want to know, so that your journey into motherhood will be so smooth and so easy. We have them available. Feel free to reach out to us, and then we can obviously send you the links on how you can get your own copies of these very resourceful materials. All right, so thank you so much, everyone. I just want to make sure that everybody can. I think I've shared all the information, I think, and I believe we have pinned it to the right platforms so we can start. I can see a lot of questions already coming on Instagram, but I just want to make sure that Facebook people are okay. So just one more 30 seconds. Let me just make sure I've copied the link. Okay, let me just copy. Just give me 1 minute. So let me just make sure that Facebook is sorted, and after that we can start. Okay. All right. So let's start now. Um, Okay, so I think I'm done with sharing on Facebook. All right, I can see somebody saying Happy New Year on Facebook. Okay, I already have a question on Facebook. I'll start with Facebook, then I'll come to Instagram. So the first question is from Mercy Madu. I say, good evening, doctors. My son, 3 years, is always looking very skinny. I guess you want to write skinny. And I've taken him to the hospital, but the doctor said I should take him home, and I'm not happy with his body. Okay, so Mercy, thank you so much for your question. I forgot to always give the ground rules again. So please, when you're asking question, always start with the age of your child. And please, if you're asking about weight, you always have to tell us what the current weight is. So Mercy, you need to tell us what the current weight of your 3-year-old is. All right, so you're worried that your baby is skinny. So some of us are going to be slim, some people are going to be fat. I mean, that is just natural variety. But for us as pediatricians, we are more concerned about the weight of the baby, whether it's healthy weight for the age or not. So it is not just about your home perception, it's about what is the baby's, is your child's weight age appropriate, is the healthy weight. So I want to recommend that you repost your question and let me know what is the current weight of your 3-year-old, and then we can take it off from there, because I don't know whether your doctor felt that the weight is okay, that's why the doctor tell you not to worry, so or not, I don't know. You've not given us some objective information, so we need more objective information to be able to advise you on what is appropriate in terms of the age of your child and or not. So just since you're still listening, I hope you're still listening to me, Mercy. So feel free to repost that question. But this time around, I want to know what was the weight of your baby, perhaps at birth or any weight you know. Just let us know, and then we can advise on what next to do. All right. So I think I'm going to go down um to Instagram. So Shami for King say good evening, Doc. Please, how many weeks of pregnancy is regarded as springtime? Okay, thank you, Shami for King, for that question. So when we talk about pregnancy, the normal duration of pregnancy is 40 weeks. So we expect most pregnancies to be 40 weeks. That is what we call dates. So when you go to your doctors and they tell you this is your expected date of delivery EDD, they are calculating based on 40 weeks. So they are thinking your baby should come in at 40 weeks. So that is the EDD. But we also have what we call term. Okay. So term is anything from 37 weeks to 42 weeks. So the date is 40 weeks, but term is anytime from 37 completed weeks to 42 weeks. So even though we will tell you that your expected date of delivery, which we calculate is 40 weeks, sometimes you can deliver your baby before that 40 weeks. Sometimes you can deliver your baby after that 40 weeks. So as long as you deliver your baby between 37 weeks of that pregnancy to 42 weeks of pregnancy, that is still what we call term pregnancy. It's still within normal time. So there's nothing to worry about. But any baby that is born before 37 completed weeks, any baby born before 37 completed weeks is categorized as a preterm baby. Okay, so babies born at 36 weeks, 35 weeks, 32 weeks, 28 weeks, anything less than 37 is preterm. Anything more than 42, we call it post-term babies. Anything more than 40 weeks, we call it post-date babies. So those are the different terminologies that you need to know. So the fact that your doctors give you a particular day does not mean you must deliver on that day. As long as you still deliver maybe 2 weeks before or 2 weeks after, is still fine. But we worry if you deliver before 37 weeks. We worry if you deliver after 40 weeks or after 42 weeks, especially. So those are the things that worry us, because babies that are born preterm, babies that are born before 37 weeks, they are at risk of complications. So they have a lot of challenges, so which pediatricians have to deal with. So that is why we don't want you to have babies born before 37 weeks. In fact, actually the lower the earlier the baby is born, the more the complications. So for example, if baby is born as early as 28 weeks, that baby chances of having long-term complications or disabilities almost 50%. Whereas the baby that is born at 36, closer to 37 weeks, even though both of them are preterm, that one is most likely not going to have as much complications. So we don't want babies born too early. We want them to stay in the womb for other 40 weeks as much as possible, at least from 37 weeks they can come out. But before then, we want them to still be in the womb, because if they come out too early, we are going to deal with a lot of complications. And some of those babies are going to die, because prematurity is one of the leading causes of newborn deaths. So we don't want babies born too early. So I hope, Chomi, that is addressed your question. Okay, the next question on Instagram still. Copied you, say good afternoon, Ma. Good afternoon. I have a baby of 2 months and I'm breastfeeding exclusively. Well done. I'm currently fasting, and when I break, you cannot fast when you're breastfeeding. We don't recommend for you to fast when you're breastfeeding. When you're a nursing mother, when you're pregnant, most religion excuse you from fasting. So there are things that are there's time to everything, okay? So at the time you are breastfeeding, that is not the time to fast. You can't, because it's not just about you now, it's about that baby. So we don't recommend that you fast when you're breastfeeding at this time. So pray, it's fine to pray, but please don't fast. Pray, and I'm sure God will answer your prayers even though you are not fasting, because you have to take care of your baby. So please, it's very risky for you to be fasting and breastfeeding at the same time. So I will recommend you don't do that. And I'm sure nobody is going to force you for not fasting as a breastfeeding mom. Just pray. Just leave the fasting part out of it. Yeah. All right. The next person, JK Lisa Coin. Thank you, ma, for your teachings. God bless you and increase you. Amen. Please, ma, when a child is having a resistant malaria, okay, and has been treated, please, subsequently, with the child have to be treated with injections. Number one, who made the diagnosis of resistant malaria? Because that word is not something mothers make diagnosis of. It's not something we expect parents to say. It's only doctors that make diagnosis of, say, a child is having resistant malaria, and we make those diagnoses because we've treated the child with at least two different kind of anti-malarials, and the child is not responding to it, and we really need to be sure the child is actually not responding to the treatment. So this is a child that you actually did a test to confirm that the child actually has malaria. You actually do blood tests for malaria. You actually do what we even call parasite counts. You actually count how much of the malaria parasite you have, and then you treat the child, and then you repeat the blood test. And the malaria parasites are still as many and not changing, despite the fact that you have given anti-malaria and you are sure you've given the right anti-malaria, giving it for the correct duration, give it for the right dosage. So these are very important information. So you can't just use those words, resistant malaria, carelessly. It's something that only doctors will use, and we are very sure that, number one, we're dealing with malaria, because it's not every fever that is malaria. Okay, a lot of people just, actually Nigerians, we always assume that when we have fever it's malaria. No, most of the time the child doesn't have malaria at all. So you, number one, that diagnosis of malaria must have been confirmed by blood test done by a reliable laboratory scientist, not just anybody. So we actually have a what we call a thin and thick film malaria parasite test that we have looked under the microscope. We have malaria parasite counts. We have given the right drug, which we are sure is not fake, because that's another issue. There are a lot of fake malaria drugs, and some people are still using. The other day, I was reading somebody saying they are giving a child masequin for treating malaria. That's chloroquine. I mean, that is like stone age kind of treatment, if you like, for malaria. Nobody treats malaria again with chloroquine in 2022 or 2023 for that matter. So again, we have to have given, so usually we use what we call ACT. It has to be two combination of anti-malaria ACT. We have to make sure the child took the drug, because sometimes mothers give drugs, the child is vomiting it, that child has not taken the drug has not gone in, so we can't even say the child has taken the drug. So we have to be sure it's the right drug. We have to be sure the drug has been taken, and has been taken for the 3 days that it should be taken at the right time. And then we repeat the malaria test, and then the malaria is still there. That is the only time we will say the child has resistant malaria to that particular drug that we use, which is very, very rare, very, very rare. So it's not a diagnosis that mothers will make. It's a diagnosis that only specialist doctors will make, because most people, number one, don't do malaria tests. Number two, they just give anti-malaria, and then and if it doesn't work, they are not even sure whether it's because the diagnosis is wrong, or the drug is wrong, or the dose is wrong, or something. So usually, most of those kind of resistant malaria diagnoses are made in teaching hospitals who do things by the books. So you'll be very, very careful to say your child has resistant malaria. So if your child has any illness, fever, and you most mothers always treat malaria by themselves, and you think the child is not getting better, don't say your child has resistant malaria. Please take that child to the hospital first. Let a doctor say the child, because number one, it may not be the malaria, which is the commonest reason. The child doesn't even have malaria. So it's not because the child is not responding. You are not treating the right diagnosis. So we need to make sure first that what is the right diagnosis before we will now um, give the right treatment. So let's even assume the child has persistent malaria, which is very, very rare. We have other drugs that we use for that level. So we have what everybody can use, your Coartem, your Nona. Those are the malaria medication that most parents will use, and we expect you to be fine. But if the malaria is not responding to that, then we start going to some other kind of drugs. Start thinking of things like quinine and all that we have to give in the hospital, which most of them usually are through injections or drips. They are not most of, though there are oral form, but usually if you have very severe malaria and it's not responding, definitely we want to go. We take it as a form of severe malaria, and we're going to go more aggressive in our approach to it. So the management is different, but I think the key message for you is that don't you say by yourself that your child has persistent malaria. The doctor has to make that diagnosis. And because by the time a doctor is making that diagnosis, it's that same doctor that will be determining what to do. So it's not something you as a parent will be taking the decision on. Usually that diagnosis will only come from a doctor, and that management will be from the doctor. So I think I'll just let it end there. All right. Okay, so the next question, Schools Channel. Okay, that's a nice name. Good evening, doctor. What will be the advice? What will be the advice for some parents who keep bringing their children to school when the child is sick, and what should the school not do? Oh, that's lovely. That's a very good question. All right, number one, in Nigeria, most of us don't do that, but is it the right thing to do is that we should have policies. We should have policies that everybody should sign to at the beginning. So you, as a school, and I'm happy you've had this ask this question, because I think I really need to actually have that talk somewhere down the line. As a school, you should have a policy, and you should make sure that parents sign the policy. And the policy are things like what happens when a child is sick. Number one, can the school administer first aid? So every parent must sign that your school can administer first aid, like give paracetamol if the child has fever or whatever, or So you must always take that permission from parent. You should, as a school, never give drugs to children without the parents' permission. You should never do it. It's really risky, because if anything happens to the child, you are liable. So make sure that all the parents have signed that they are not going to, they are happy for you to give paracetamol first aid. Two, you must also take from parents what are the hospitals that the parents use when the child is sick. What would the emergency contact, like if you can't get the parents to come and pick their child to the hospital, which hospital can the child be taken to? They must always write the name of the doctors and the hospital that they are registered with. You must have that information. Parents must give it to you. Three, you must have a policy as a school that if a child is sick, you will not allow that child into the classroom. You should have that policy. So usually sometimes children don't fall sick at home, so you can't blame parents. So children may fall sick in the school. So you should have like a sick bay or a first aid or a first aider teacher who can take care of the children, and you should know what the first aid to apply. And of course, you call the parents, come and pick their children. So that policy must be. But if a child is already sick, there are some sickness you should not allow the children into the school. Okay, especially children who have what we call contagious infection. A child who is having measles, a child who is having chickenpox, a child who is having mumps. These are things that will spread to other children in the school. So this is not about being nasty or being mean to those parents by saying you can't allow the children in school. It's about protecting the other children in the school environment. So you tell parents, and all parents need to sign to that. So if your child has fever, rashes and all that, no, the child cannot come into school. So usually if it happens, if you discover it in school, you should isolate the child, take the child to another room alone, and then call the parents, come and pick the child. And until they get a letter back from the doctor to say the child is well now, then you shouldn't allow the child back into school. And these are things parents should sign for at the beginning of the year. So it has to be a school policy. So things like anything that can spread, you should make sure that you don't um, allow those children into school, and or you may ask for a doctor's medical clearance or paper or whatever to before you can allow them back into school. So these are things you can do. So it's about being firm. It's about making sure parents already know at the beginning of the year, they already signed that consent and they know that this is school policy and they're going to abide by it. So really it's so important because children spend so much time in school, and by whenever the children are in school, the school is responsible for them. You are the de facto parents at that point. So, and health issues are very serious. Things can go either way. And so you don't want to take responsibility for what you cannot handle. So it's best the parents take care of their children. There is no emergency with education. And I want to say that parents sometimes do as if children misses school, the world is going to end. The world is not going to end. Okay, the school is not an emergency thing. Children can always get education later. Their life, their health is priority. Okay, so if a child is sick, the priority is their health. Even if it is WAEC, even if it's exam, doesn't really matter which exam, because it's only a child who is well, who is alive, who can write exam. So parents always need to understand that. So you at school, you also need to emphasize that to them. And if there's a way you can help, for example, maybe if you want to send the question, like for example, usually the time that parents really are aggressive is during the exam period, you can send the questions to school. I mean, to the hospital. They can write the exam if they want to, or you can give them opportunity to do those things outside the normal time. So sometimes the schools must be flexible with that, because those are the things that worry parents, that the child has missed exam, that the child is going to repeat, all those things. No, we should be flexible around those things. But the health of a child is priority over education anytime, any day. So no child should be forced to come to school, because children have a lot, anything can happen. So parents should prioritize the health of the children. School should have policies. Make sure that parents sign those policies, and of course, you are firm about it. So that is what I'm just going to say. It's actually a very big topic, which I think I'm still going to come one day and take it as a whole topic on its own, and we can talk about it. We have not even talked about crutches and all that, which is another big one on its own, but it is doable. All right, I think I'll post on Instagram and I'll go to Facebook before Facebook people begin to crucify me. All right, thank you. So just stay there, don't go away. But let's just take a few more questions on Instagram, on Facebook. All right, so the next question is: good evening. My 4-month-old has catarrh. She has this since she was 1 month old, so she's had it for 3 months. Okay, I don't know why it has refused to go. I also don't know. I understand she can't be given anything. So a child should not have catarrh for 3 months. Okay, if your child is having catarrh for 3 months, there's something wrong. Something is wrong. Most cough catarrh usually should last 2 weeks maximum. So if your child is having catarrh for 3 months, there's something wrong somewhere. So that child definitely needs to see a pediatrician. That child has to go to the hospital. You need to know why. It's either the child is getting the catheter over and over again, it's being reinfected, or there's really something wrong somewhere. So this is not normal for a child on exclusive breastfeeding to be having respiratory tract infection for 3 months. No, there's something wrong. So you need to go back, and you may want to see a pediatrician this time around and know what is it. And you also make sure you are not exposing the child. So for example, siblings that go to school, that they come back home with their cough and catarrh, and then they carry the baby, sneeze on the baby, kiss the baby, they are going to transfer the germs to the baby. So or adults also carrying baby, those are the ways babies get all this infection. Most babies should not have infections unless other family members bring it home to them. So please make sure that you're also taking precautions. The baby is not exposed to adults or siblings with cough and catarrh. You're washing your hands, you're exclusive breastfeeding, you are not using sprays, cooking in the room, or taking baby to the kitchen, things that could irritate the airway. You need to take all these precautions first and make sure your baby is well immunized for age. So if you're taking all the precautions and your child is having cancer going for 3 months, there's something going definitely not right. So you have to go back and see a pediatrician for the next further evaluation. All right, the next person is from Regina. Say, my son is 13, nearly 14. He says he hears voices. Is that normal? It is never normal for anybody to hear voices. So, I mean, that's not normal. But you need to clarify exactly what voices he hears. What does the voice tell him and all that, so that we know. Sometimes teenagers can prank you a lot, so you really need to be sure. But if you're really sure your child is serious and is hearing voices or voices telling him to do something, especially to hurt himself or to do some silly stuff, that is not normal. So definitely that is something that we want the child and adolescent mental health professionals to have a look at. All right. So he used to hate button shirt when he was small. Now he hates it even if I wear it, or refuses to use squeeze covers with buttons. He has become quite rude in his talking and behavior and physically aggressive to me. So okay, he watches YouTube short videos and play online games. That's like being said no to. So anyway, okay, so this child definitely needs to see us. This child needs to see either a developmental pediatrician or a psychiatrist, a child and adolescent psychiatrist. There's more going on with your child. So I really, really want you to go for evaluation so that the child can be properly supported. There's more going on. I'm not really completely sure it's just a developmental issue or something mental health. So, but definitely hearing voices is a red bell, a red signal for us. We don't like that. So it's best that a professional should see the child. They will do a proper evaluation and then we can advise you what to do. So that's why it's important. All right. Okay. So the next question. Hi, dog. The left leg where my 7 week receive immunization is swollen and paining him. This makes him to cry a lot. It's also hard and reddish. When was the immunization given? That's the most important information. Anyway, so it is not unusual for babies to have some bleeding into the muscle when they get the immunization, because the penta immunization is a deep intramuscular injection. So there will be some bleeding into the muscle, which is what is causing the swelling. And of course, it's painful. We know that. So what I normally recommend for parents, right from the one, you should apply ice pack. So you just get all the small, those ice cubes, put about 4 or 5 of them in a handkerchief or a face towel, and just put it gently on that tie, intermittently put it on it. Don't rub it. So don't rub. Most of parents always massage. When you massage a bleed, you make it bleed more. So the swelling will get worse. It will be more painful. In your process of massaging, you are going to introduce germs and it's become infected. Then we have what we call an abscess, so which will now require antibiotics, which requires us cutting it open to do incision and drainage. So we don't want all that. All you need to do just is to apply those eye packs every few seconds. Give it a break, apply it again. Within 2-3 days, it will go down. You can also give paracetamol if the child is in pain or has fever. So it will go down. Initially, when it will still be hard, but it won't be red and it won't be painful. You don't need to worry about that. That is just the bleeding inside the skin that is now becoming what we call organized. It's forming like a clot, and eventually the body will resolve it. So that is all you need to do. This information, I'm always surprised because when we go to hospitals for this immunization, we should have this health talk before the immunization. And I think some of us will go late. So the nurses would have given the head talk and they would have talked to you about this thing. But I guess some mothers also, we are also there gisting. We don't listen to the nurses when they are giving the head talk. Please listen, please go early, because it is our responsibility to tell you all these things. We should have told you all the side effects to expect. So when a child has immunization, you should know that they can have fever. So you don't need to panic about that. Just give them paracetamol. If you don't know the dose, they should have told you in the hospital the dose to give. Usually for the first 2-3 days, after that you'll be fine. For this injection on the thigh, they can have swelling, they can have redness. Just apply ice packs on them. Don't massage, don't put kerosene, don't rub, don't put ori, don't put nothing. Just ice packs, and be very gentle. Some of us, even when the child is crying, we just be carrying them anyhow. You have to be very gentle with that, with the legs when they have immunization, so that you handle them gently, so you don't cause them much more pain. So these are side effects we should expect from immunization, and we should know what to do. So I'm always very worried when mothers ask this question, because I'm like, somebody is not doing their job, or is it that we are the one not listening? We should have this talk. And finally, before you take immunization for your child, always ask the nurses what they are going to give, because I've seen so many errors when it comes to immunization these days. Somebody was saying last week that they gave a 3 months old baby measles and chickenpox injection in by error. I mean, the nurses are human beings. I mean, or the health workers, whoever is giving immunization, we're all human beings. Human beings can make human errors, but we can prevent these errors by, if both of us are working together. So before they give your child anything, ask them, what are you about to give? Injection, there's no emergency in giving any injection. It's an immunization. It's something that you take your time. So ask, what are you going to give my child? So they can double check. I'm going to give Penta 1, Penta 2, Penta whatever. If you notice that it's the wrong thing your child should take, that's why you have immunization card. You should check your immunization card. You should know what your child is supposed to take for that day. My child is 3 months old, is coming for Penta 3. So if somebody is not saying, "Oh, I'm about to give measles and yellow fever," then it's no, this is not for my child. My child is supposed to take Penta 3. Is that what you're going to give? Please, you have a right to ask. You have a right to know what anybody is going to inject into your baby. You have a right to refuse what anybody is going to inject into your baby. These are your rights. So don't say, they will say you are being rude, or no, you are not being rude. You are being right. You have to be sure. Because sometimes when parents now come to me and like, okay, Dr. Gbemi, they gave my baby the wrong immunization, and what do? I'm like, okay, what are we going to do? There's nothing we can do. We can't take out the immunization out of the baby again. And some of them are risky to give too early. So we just hope for the best, that nothing happens to the child. And I'm just like, how come you didn't know that's what they're going to give to your child before? I mean, we should always ask. Please ask. Don't assume everybody knows. Sometimes people are distracted. They are busy just talking, and then they just pick they call the right child, maybe the wrong injection. Human errors. I'm not blaming anybody. Human errors can happen, but I think we can help our health professionals by double checking before they give, especially the injections. Please double check, make sure they give the right thing, and please know the first stage to do when your children have immunization. There's no need to panic. The benefits of the immunizations far outweigh the risk or the small side effects that they are going to have for just 2-3 days, and you'll be fine. But there are side effects that are serious. So usually when your child has taken immunization, please don't rush out of the hospital. Some of you are always in a hurry. No, don't be in a hurry. You should sit down for the next 15 minutes in that hospital. Because if your child is going to have what we call anaphylactic reaction, it's going to have a severe allergic reaction to an immunization, it's going to happen within 15-30 minutes. So the hospitals that give injections, we have the emergency drugs for anaphylaxis for injections. So we can quickly give the hydrocortisone, whatever we need to do, we will give it there, and the child will be fine. So please don't rush to leave the hospital after immunization. Wait, let's be sure there is no reaction and all that. But if you get home, because some reaction could happen after you go home, if your child is crying too much, or having convulsions, or having severe rashes, please take the child back to the hospital. Take the child back to the hospital. But if it is just pain, if it is just small cry, but you can still console the child can still suck. If it is just fever, you can do something about that one. But anything like convulsions, the child is not themselves, all those kind of things, please, you have to go back, because those are more severe. They are very rare. These are like one in maybe 1 million baby will have a conversion with penta, but we will never know who is that one person that is going to have it. So most babies don't have it, but the few that the very, very, very few one that will have it, we need to know and we need to seek the right help. So I hope the Facebook user you are happy. All right, let's move on. So the next question. The next question say my baby is 15 weeks. It's on mixed feeding due to some reason. This year everybody is on mixed feeding. Okay, I'll come back on that later. It is 4 days now. She hasn't pooped, but she mess and it smells. There's nothing wrong with babies passing fats or flaters or whatever we want to call it. There's something wrong because mothers keep asking that question all the time, and there's something that is normal for flaters or fats to smell. So there's nothing wrong with that. Okay, but if your child is on mixed feeding, formula feeds can lead to constipation and your child's stool may be hard. So, and that is why you have to give them plain water with the formula. So, what we recommend is that you breastfeed your baby exclusively. No formula, no water, just breast milk only. Babies on breast milk may not pass stools every day, but when they eventually pass the stools will be soft. They won't be hard. They won't be hard. They will be soft. So if your baby stools are hard and they are not coming out frequently, that is constipation. And for 15 weeks old, most likely is the formula. So you really need to watch. And most of you, when you are mixing the formula, don't do it as the spirit leads you. It is not as the spirit leads. There is a rush, there's a way to mix it. So there's a right scoop to the right volume of water. So make sure you are following that. If the manufacturer has said you should put 1 scoop to 30 mils of water, you start with the 30 mils of water and then you add the scoop. It's not the other way around. Some of you will put the scoop first and then you add the water. When you add the water that way, you are not going to add up to the exact volume of water. So you start with the water, 30 mils, and then you add the scoop. So that is what may also, because sometimes if you don't make the formula properly, you can also make it too what we call concentrated, and that can also lead to constipation. So those are the reasons why that can happen. So, but if you want to avoid all this stress, just breastfeed exclusively. All right. Listen to your pediatrician this year in 2023. Listen to the pediatrician. If the pediatrician say breastfeed exclusively, don't do your own thing, because when you run into trouble, you're still going to come to the pediatrician. So, like your people will say that, or like eventually when you run into trouble with all these things, you're still going to come to the pediatrician. So then why don't you just follow what the pediatrician says? Many people think it's easier to formula feed. It is not. It's actually easier to breastfeed than to formula feed, because the stress that goes into that and the consequences you are going to be dealing with will be worse if you have just breastfeed only. And if you are breastfeeding and your milk is flowing, there is really no reason why you need to mix it with the formula. You can just keep breastfeeding. The more your baby suck, the more your milk will flow, because that's the reason many of you say you are doing misfeeding, because you feel you are not producing enough milk. No, the more your baby suck, the more the milk will flow and your baby will have enough milk. So giving formula is actually going to reduce your breast milk supply, because breastfeeding is demand and supply. The more the demand on it, the more the milk that will flow. But when you are giving other things, then there is less demand, and that is why the milk volume also reduces. So it is best to just follow the right thing and not to lead, because at the end of the day, we're still going to have to deal with all these issues that we don't want to deal with. All right, so we'll talk more about breastfeeding in later during the year. All right, the next person say, good evening, doc. My 8 months old baby sleep with his tongue up. I don't understand that question. Tongue up, mouth open, or tongue up? I don't really understand. Do you want to clarify what you mean by that? Is it that the baby opened the mouth? Because if your baby is sleeping and the mouth is closed, I'm wondering, how did you know the tongue is up? So you need to clarify so that I know what to sleep. And then how do you put your baby to sleep? Make sure your baby sleep on the back. That is the right way for the baby to sleep. Okay, so I'm not sure I understand your question, so I'm not sure where. So let's take one more question before we go back to Instagram. 2-year-old daughter is having cancer for 2 weeks. Okay, she uses vitamin C syrup. It keeps coming and going. Any other treatment, there's no other treatment. Most cough and cancer, if there's no fever, if there's no cough, if there's no difficulty with breathing, they are due to viruses. And usually viral infection will last like 2 weeks and then they will stop. But like I answered the previous question, you must make sure that the child is not getting re-exposed to other people who is having cough and cancer. You must make sure that all the trigger factors, maybe the smoke, the generator fumes, whatever it is that is triggering, irritating the airway, you make sure they are not, you've dealt with them first. So if after 2 weeks you're maybe still having continuous catarrh and you are making sure you are doing everything right, then you may want to go to see your doctors, because there are also some conditions that tend to be recurrent. Like some people have what we call allergic rhinitis, so they are reacting to something. So when they smell something, they start coughing, sneezing, and then they start having runny nose and all that. So those kind of people may need additional treatment before the allergies. But the most important is to actually avoid the allergy if possible. So, but those are the things that you can do that may be useful. All right. The another question. Good evening. My 2-year, 4 months has this small growth like a boil on the back of her hair. I hope. I noticed since she was 1+, look at the pediatrician, was told it was not paining her, there's no problem, but I feel bad. So what did the doctor tell you it is? So it's more important to know what it is than whether you're feeling bad or not. There are some smelling that we're not going to do anything about. So what did the doctor tell you is the swelling? Is it lymph node? If it's a lymph node, for example, it is a normal thing in the body. So we're not going to do anything about it. You leave it alone. So I think what is more important is to know what is that swelling, and then that will now determine whether it's something you're going to live with or it's something that can be removed or not. So from what you told me now, I'm not really sure what it is, but I'm suspecting maybe it's just a lymph node. If it's a lymph node, you don't need to do anything about lymph nodes. They are normal, and sometimes they're a little bit big, bigger, especially when the child has infection, but they will go back to their normal size later. So, and usually we don't do anything about them. But if there's something else external, if it's something external to the hair, not something you can touch, something you can hold, maybe it's ear tag or something. I'm just thinking of all the possible things that can be swelling at the back of the hair. Then those ones can be removed if it's bothering you. But you've not told us. So when you go to your doctors, more than the doctor say I should not worry about it, you should always tell us what the doctor actually said in terms of this is the issue, this is the name, this is the explanation for this. That help us to know how to continue from where your doctor stops. So, but if you didn't, if you have not told us that one, we don't know what your doctor have told you. We don't know what the doctor said it is. Then we can't tell you what else to do. So, option 2 is to go back to your doctor and have this conversation again, whether it's something you want to remove, whether it's worth removing it or not. So, but I'm not sure what it is. So, I won't be able to advise beyond that. All right, let me come back to Instagram. Okay, J.K. Little Queen said she has been treated 3 times. The test was done with parasite count. Well, okay, so J.K. Lizzie, if you're already with doctors, just continue with them, all right? Your doctors know better than I do because they know your child, they know everything, they know what they've done, they know what they've not done, they know what drugs they've used, they know what drugs they've not used. So they are the one that should. It is not a question that is for Instagram because it's obviously something that you've been doing. So just continue with your doctors. If your doctors think they are struggling, they can refer the child because there are specialists. So there are people that their specialty is malaria. That's all they do. So sometimes that's the advantage of going to a teaching hospital. So if as a pediatrician I'm managing a child and I think I'm doing everything I should have done and the child is not getting better, then I can invite specialists. So we can invite the microbiologists, for example, and tell them this child has this malaria, we've treated with these drugs and it's not going. So the microbiologists will give us their own expert opinion. So it's very, I think we still have malaria drugs that work in this current century. So that's the information we, and obviously for you to be asking that your child has not been, does your child intend to be treated with injections? So I'm assuming your child has not been treated with any injection. So that means your child has not been treated for resistant malaria or severe malaria, because resistant malaria or severe malaria, we require that your child is on admission. We require that they put the child on medication that will go through the veins or through injections. So that's why I say your doctors should continue, or if they are not sure what to do, then they should refer the child to hospital. All right. Okay, she's been to Asokoro General Hospital. Okay, yeah. Okay, so she asked to be admitted at Asokoro. I'm not sure I get the last part, but whatever the doctor says, just follow their advice. That's what I'm just going to say. I don't want to. That one is more than online stuff. We have to do it one on one. All right. Didi Diary said, "Doc, my son was diagnosed with autism. We went for hearing test, and it was okay. They said we need speech therapy. Please, can you drop contacts or speech therapists? Because the one I was able to reach, I don't know the last part. It's too expensive. How do you know the one I'm going to send you is not going to be more expensive? All right. So speech therapy in Nigeria is expensive. That's the honest truth, because speech therapy, we don't have many of them in Nigeria. We don't have many speech therapists. So then where are you based? That's another thing. So this kind of information, I think it's better you send us a WhatsApp message, then we can give you further advice. But speech therapists generally, they are expensive because they are not, most of them are private, so you don't tend to get them in government hospital for cheap. So yeah, but I'm also not sure who made your autism diagnosis, because they should have been able to advise you further about that as well, so you can also ask them. All right, let's move on. Okay, the next person on Facebook, my 4-month-old has catarrh, have blocked nose. If the nose is blocked with mucus, you can use normal saline drops, and normal saline drops will soften the mucus and it will flow out. That's all. But make sure you are breastfeeding your baby exclusively. Keep the baby warm. Keep baby away from those who have cough and cancer and all that. All right. Somebody says, is it normal for a month plus baby to be stretching constantly? Okay, I think this person, you've asked this person on our Facebook group, you need to post a video of what you mean by stretching, because I always, there's some words you used that's what you meant, but when a professional sees it, it's a different thing entirely. So we need to be sure this child is not having convulsion. That is actually the short answer. We need to be sure this your stretching is a normal stretching. Anybody can stretch, but I'll have to be sure that you are not calling a convulsion stretching, because you say it's stretching constantly. Baby should not be stretching constantly. Baby should sleep and be calm. Then they wake up and they will stretch and eat. And so we really need to be sure what this stretching is. So I've advised that you put a video and let's see it, and then we can advise you further. All right. Somebody said my baby's scalp is scaly. It is not dandruff. I don't know what to do. Number one, when you're asking question, always put the age of the baby so we know which baby, and then we can figure out what are the conditions we expect based on the age of the baby. So you still need to see a doctor, because obviously we need to know why the scalp is having that scaly picture, and then we can advise you what to do depending on the age of the child. Some scaling could be a fungal infection like ringworm, or it could be something else. So we really need to see. So if you're on our Facebook group, you can put it with a picture, or you can see your own doctor and then you can advise you further. Okay, I think this person asking about the tongue. The mouth is open and the tongue is always upward. I won't worry about that. As long as your baby is not choking or having difficulty with breathing, the position of the tongue is not something we need to worry about. All right, I think that's all. I think I've answered all the questions. Hope I've not missed any. Okay, no, I've not. All right, yeah. All right, so I think we've done today. Let me be sure I didn't miss out anybody's question. Okay, I didn't. All right, thank you so much, everyone, for joining us for today's ATP Live. If you still have questions, for those of you who are likely watching the recording of this video, you can always post your questions directly to Ask the Pediatricians Facebook group. So our groups are available from Mondays to Saturdays, 24 hours daily. If you have any question about the health of your children, feel free to post your questions there, and our professionals, our moderators, they'll be able to advise. It's an advice line. It's a first aid advice line. It is not an hospital. So don't be upset if we tell you that you have to go to the hospital, because like I said earlier, there are some things that we cannot deal with online. Some things have to be dealt with face to face. Okay. And for those of you who want to really speak to our professionals face to face or one on one, you can send us a WhatsApp message. I think you can see the number on my back if you're watching on YouTube or Facebook or Instagram, Facebook or YouTube. But if you are watching on Instagram, I think I put this on the at the top of our the very first comment, the pin post. So you can see our number there. You can send us a message and we will get back to you. Of course, when you are trying to get in contact with our professionals by law, we charge you the consultation fee. So that is not free. So it's only Dr. Gbemi's advice on this platform that is free. So if you are going to go one-on-one with any of the professionals, please be mindful that they don't run free service. They are going to charge you the consultation fee by law. But it's optional. You don't have to use that, but you can also go to the hospital. I'm just letting you know that that option is available. All right. Okay, so the person asking question about dandruff and scaling. I just answered your question. I don't know, maybe you didn't get me. I already answered that. You need to put a picture of it on our Facebook group, or you need to see a doctor who can see the child physically and recommend appropriate treatment. All right. So on Thursday, I'll come up with a new episode of my podcast. So watch out for that. And you can listen. I won't tell you which topic I'm going to discuss, but this year I'm going to do a lot more podcasts discussing different topics. And you can listen on Ask Dr. Gbemi podcast, or you can listen on our Facebook group, websites, YouTube, everywhere. We'll always put it there. So thank you so much, everyone, for joining me today. And I think I'm doing well this year. I'm trying to stay within my time. So thank you so much for joining us. And I'll see you again, same time next week, Monday, for another episode of ATP Live Monday, where you can ask any questions you have about the health of your children, and we'll try and answer them in 1 hour. Join me on Thursday for on the podcast on Fresh Waves Radio for ATP Hour, where we're going to be discussing a particular topic as regards the health of our children and beyond. And after that, we will you can always, as I said, post your questions directly on our Facebook group every day, except on Sunday, because we don't have the capacity to answer your questions on Sunday. We take a break on Sunday, but Monday to Saturdays, post your questions. Give us some time, at least 72 hours, but we'll try our best to answer your questions. And for those on Facebook who have been struggling with reading comments, we've been getting a lot of posts about I can't see comments. Sorry, it is not our fault. That is a Facebook bug or glitch. whatever. So you need to report that to Facebook. Make sure you can uninstall your Facebook app, download it again, refresh it, make sure it's up to date, make sure you are using a full face. Just do everything that you can do, clear your cache, do all those ones. If everything you've done has not made any difference, please report it to Facebook, and then Facebook will answer you, will tell you what to do. I know Facebook is doing a lot of updates, so some part of their system is a little bit kind of tricky at the moment, but I'm sure within a few weeks everything will settle and everybody will be able to hear and they'll be able to read and they'll be able to do everything. So thank you so much for joining me. Have a wonderful evening. Bye, bye, bye.